Hello and welcome to another mini lecture of Professional English for Medicine. The topic of today is primary care. Now let's take a look at the first part, the National Health Service. The National Health Service is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is free, but there is a prescription charge for drugs and appliances such as a cervical collar, with exemptions for some patients, such as children and the elderly. Primary care is provided by general practitioner or GPs, nurses, dentists, pharmacists, and opticians. GPs work in practices of 1 to 20. Practices are based in the surgery and look after the health of from 1,000 to 15,000 people in the local community. They also provide health education in areas such as smoking and diet, run clinics, give vaccinations, for example, for influenza, and may perform a minor surgery such as removal of warts and moles. If a patient needs specialist care, the GP will make a referral, which means refer the patient to a consultant in secondary care. Patients are normally seen on appointment basis. Home visits are made when patients are housebound, which means they are unable to leave their homes or too ill to attend surgery. Out-of-hours treatment from 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes shifts of GPs and locum GPs to cover if someone is absent. Here, the noun surgery had three meanings actually. First, the building where GPs work. For example, the practice has moved to a new surgery on the high street. Second, a time when GPs see patients. For example, morning surgery is from 8:30 to 12:30. 3. It means the work of surgeons. For example, the patient needs urgent surgery on a burst appendix. Now part 2, the practice team. A typical GP practice employs receptionists. They are responsible for initial patient contact, making appointments, taking requests from repeat prescriptions, taking messages from patients and other healthcare providers, and for filing and scanning documents into patients' records. The practice manager has responsibility for finance and sometimes for IT, supervises the reception staff, hires locums, and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular disease clinics, as well as one-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals, like district nurses, health visitors, midwives, and physiotherapists. When they work with district nurses would visit temporarily housebound patients, such as recently discharged hospital patients, to change dressings, such as ulcer dressings. Health visitors visit families to carry out checkups on young children, particularly under 5s, to make sure they are healthy. Special attention is paid to families in need, such as those living in poverty. They also do baby immunizations. Midwives run clinics for antenatal patients. Physiotherapists provide hands-on treatment, but also teach patient exercises they can do to improve their conditions after an accident or operation. Part 3. A GP's Day. Dr. Stewart works in a practice in a small market town with 3 other family doctors. The surgery is in the center of the town and is shared by 3 practices. This is a typical working morning when she's not the duty doctor, responsible for emergencies and urgent problems. Well, up to now we have been discussing the National Health Service, the practice team, as well as a GP's day. Hopefully you understand. It's time for us to take a break. We'll see you next time. Goodbye.